Okay, hi guys. Hope everyone is doing well today. This is Dez Mahal with Talk with Dez, and today I am very fortunate to have Monica Nagra, a registered nurse with Fraser Health, join us and give us tips on what we should be doing with the current situation with COVID. And we did plan this around the 7 o'clock shift change, as that is the time that a lot of us have been going out and banging our pots for the health heroes, and my children have been doing that as well. But I want to just thank you, Monica, and welcome you first.
Thanks. Thanks, Des.
How are you doing today?
Not too bad. Pretty good. I had a day off today, so it's been nice.
That's good. I mean, a well-deserved day off.
Yeah.
So tell us a bit about the situation, and thanks for agreeing to do this and coming on and giving my followers and my friends tips, because this is a challenging time for us. And I know a lot of people that are in different situations, whether you've got a new baby at home, or you've got an elderly person living with you, or somebody with, autoimmune issues or something else that could compromise it. But then there's also some of us that are very healthy, and there's so many different friends I've got right now that are kind of like, what should I be doing for myself? And so first, tell us about the basics of, any tips you want to do with COVID. Like, what are the things that everyone should be knowing?
Well, the thing is, like, in a way, it's very like it is a pandemic because it's spreading really fast. It's very contagious. That's why we've been put on strict precautions of staying at home, this whole
Mhm,
social distancing thing. If it wasn't as infectious, we wouldn't be under such strict measures right now.
mhm,
And there's still not enough, I guess, research you could say. Like they're still trying to figure out more. Initially, they were saying that it just affected the lungs, but it actually affects other organs now. They're starting to realize,
mhm,
and people thought it's just the elderly and the immunocompromised, or like people 60 plus that have underlying health issues that were being mostly affected, but actually that's not correct. People of all ages are at risk, and reality is it just depends on your own immune system of how your body's gonna react to it. So somebody could be really healthy, but their immune system might not be as strong, depending on how sick you've gotten in the past or what you're exposed to usually, versus somebody else who might not be as healthy but might have a stronger immune system. Just because people have underlying health conditions doesn't mean that their immunity is necessarily not good. So I think the main thing to remember is that everybody is at risk. It doesn't matter what age group you're in, or how what your like health history is. Like everybody has to take equal precautions.
well, that's good to know. But tell us a bit about like different age groups. Like, there's so many different things I'm hearing about. The first question I had was, what about babies? Like, are babies being affected by this? Can babies be affected by this?
So I think the chance of babies being, because babies, especially newborn babies, a lot of them are breastfed, so um, that has some kind of a connection with immunity as well. Like breast milk apparently is supposed to provide more immunity, and they say a
Mhm,
lot of new mothers as well. Same thing, that it kind of helps them as well, like being a new mom. But at the
mhm,
same time, I have heard, I can't verify, but I did hear of there being one death of a baby, but it wasn't just because of COVID. They said there was other health conditions as well. But I
mhm.
think he was, and I can't verify. Like it's just something that
Well, of course. I mean, that's just it. Just you have all these questions, like, like you had really mentioned about uh, different people with different even though you may have an autoimmune the issue or something, but it may not affect you,
yeah.
and it will affect a certain person. So that's why and you may be able to fight it off. Like I recently found out about somebody else having it, and I was quite shocked because I didn't think that person would be able to make it through. So, and it is closer than we think it is. It definitely is happening to people in our community, and
Yeah.
we just have to look after ourselves. So I think for hygiene wise, now give us some tips on daily hygiene, because I
I
think
mean,
people are like coming home and like what throwing away their grocery bags. They're washing every fruit and vegetable like thoroughly. They're, what is right and what is too much, do you think? Like,
well, okay, so I mean, if you like say there's stuff that doesn't need to be refrigerated right away, box stuff, and if you have like a garage or something that you can just leave your groceries sitting in for a few hours, it's always good to do that. And then, or like have an area where you can um, bring your groceries in, pile them up, and have like a clean side and a dirty side. And even before you go grocery shopping, it is good to be prepared,
mhm,
and have stuff set out so that like your sink's ready, that you can throw all your produce in there and wash it. And the thing is, once again, it is a good idea we usually wash produce as it is, before we use it. I think most people do, but it like bananas and stuff we normally don't, but you just don't know whose hands may have touched that produce. And
mhm.
it could be contaminated, could not. They say on certain surfaces it doesn't last very long, so even plastic bags, I think after a few hours you're okay. But it's just it is, I think, becoming a new norm where you come home and you like throw all your produce in and wash it. And I think just to be, if you have that time to be on the safe side, it is a good idea. And like, yeah, unfortunately, because like even now, like, our groceries, the carts, I don't know how often they clean grocery carts. So it is good to kind of wipe things down. But as per hygiene, so like, I know a lot of people have been going crazy over Lysol wipes and hand sanitizer. So the first thing is, the only time you really need to keep hand sanitizer on you is if you're gone out. So if you're at like the grocery store and you're getting back into your car, or like you want to keep your hands clean or sanitize them then. Or if you're getting gas or something, anywhere in the public where you're touching something, doors and stuff, that you need to, so keep it in your purse, keep it in your car. But at home, you should not have to be using hand sanitizer. You should be washing your hands with soap and water for at least 20 to 30 seconds. And 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 that's it. That's all you have to do. Just practice normal hand hygiene. If you're touching things that you think might be affected by like that, might be contaminated or dirty, just wash your hands at home. And same with cleaning. The Lysol wipes are good to keep. Like, say, you were out and you quickly have to wipe your phone when you come home, or your purse or something, or like you want to wipe your door handles, your car door handles and stuff. Like, I mean, those are just extra precautions you can take. But your in-home cleaning, you can actually just do with hot water and bleach. Wipe your surfaces down with hot water and bleach. You don't need to Lysol, because a lot of those wipes, they have bleach in them that helps kill or disinfect. So people have been going crazy, but if you just buy bleach for a little bit, because it's very concentrated into hot water, it'll actually help kill those germs. And inside your home, you don't need to. And if you're not like, if you live alone, or and you're not coughing, or even if you live with other family members, but you're not coughing or you don't have any symptoms, you don't have to wear a mask inside your home either. And like wearing a mask when you go out, it's good because you're protecting other people, but you don't have to if you're keeping a distance and you don't have any symptoms. You're okay. No, I personally don't wear a mask when I go out because I don't have any symptoms. I keep my distance and I try to go out minimally, but so in public. But a lot of people have, which is great because it is helping protect other people from you, just in case you are a carrier or whatever. But I just think that the whole
So if you
theory.
don't think you're a carrier, you shouldn't wear a mask. But like, clarify this for me, because today I was at the grocery store and I decided, okay, safety is first, so I'm gonna wear the mask. But there's only one other person wearing the mask, and honestly, I felt like everyone was staring at me because I'm wearing the mask. So what really is the thing people should be doing?
Well, I think personally, it's a personal choice because
Mhm.
people might feel more comfortable wearing a mask. They feel protected. If somebody feels like they're at risk, because it isn't an airborne disease as of yet. What we know is it's droplet, and so it's more if you touch something and like that, you know um through like body fluids or saliva or something. So if somebody spat on something or they sneezed and they touched their mouth and then they touched something else, that's how you're going to contaminate it. Or say like somebody sneezes and like you walked by where they sneeze like within a certain like span of time, you're at a higher
Mhm.
risk. So for that, in that case, like a mask would help you. But I mean, in general, like if you're aware, if you're just going for a walk or something, you don't need to wear a mask if you're not having any symptoms. If you're not constantly sneezing, coughing, you don't have any kind of like cold-like symptoms, then I would say you don't have to. But some people prefer, I think, and they're saying that you can wear a mask. It's not just to protect yourself, it's to protect others from you. So it just depends, like I can't say that you shouldn't wear a mask or you should. If you feel like it's helping you or it makes you feel better, then go ahead, wear a mask. There's nothing wrong with it. And once again, it's not just protecting yourself, you're also protecting others from yourself. So
Yeah, no, that's true. That's what I was thinking today. Like, I trying to just do everything I can, right? And I'll go places, and some people will tell you to remove your gloves, and really to find out what we should be doing and what we shouldn't be doing. Then again, just going back to hand washing, why I brought up this slide here. So going too far with any of this, and like making sure that you're not over, like washing your hands. Like now that I've been washing my hands so much, I go out and I'm obviously using a sanitizer as much as I can, but my hands, honestly, my skin is starting to get dried out, and I'm using a lot of moisturizer, but even the moisturizer isn't really keeping up with it at this point.
So here's the thing. For like, I mean, I work, so I am not under this whole self quarantine thing that where I have the luxury of staying at home. I have to leave my home.
Hmm.
But when I do like grocery runs or I have to get stuff, I try to just do it in one day. Get my gas in one day, get my grocery in one day, because I don't want to be going out so often and putting myself in an environment where there's a bunch of different people. And I personally try to go at times where I feel like it won't be that busy. So most people, like, what I would suggest is like, have your day where you go do your grocery run. If you can get your groceries delivered, that's also a better idea because you're saving one less trip. But if you have to go out, go do everything in one day and then just do a proper clean, because if everything's disinfected in your home, like I said, bleach and water, your normal cleaning things that you use, um, you should be fine. And then like if it's just you're not going out, you're not most likely not going to be putting yourself at risk for getting it, right? It's only if you're going out that you should be more worried about like washing your hands more frequently. Like for me, when I go to work, even at work, if I'm um like around people or touch things, I have to wear a mask at work, especially when I'm talking to patients. And like nurses that are doing direct care, especially in the ER, they're always wearing masks, which isn't comfortable, to be honest with you. It's not fun wearing a mask for your whole shift and protective goggles, but they have to because it's not reason or feasible to be constantly taking it on and off, so they just keep it on their entire shift. For me, I don't do direct patient care, so I do like talk to patients sometimes, so I wear a mask then. But in terms of hand washing, like when I'm at work, yes, if I touch things, I'm very careful of washing my hands or using hand sanitizer. But if I've been home, if I have 4 days off and I've been in my home and I haven't been going out, I just wash my hands like how I usually would, right? You don't need to like be washing your hands every hour. If your house is clean, your home is clean, it's disinfected. So a good way to do it is like the day that you do your grocery run and do all your like chores or whatever, disinfect your groceries and then maybe do a thorough clean and then you're good, right? For the rest of the week. So you're not stressing about touching things in your home or whatever that you feel like might contaminate you, right? So, or put you at risk
Mhm.
for the infection.
So physical distancing, like, we've been seeing a lot of things on media and different things, but as a nurse, from a nurse's perspective, now physical distancing, like today I was at the grocery store and you still got to walk by people in the aisles, right? And even though at the tills they've gotten much better at uh, putting the line and everybody staying back and kind of having a person up there monitoring. And most of the grocery stores I've been to, they've done this. So tell me a bit about that. Like, what do you think for physical distancing? What exactly is appropriate?
I think like so in simple terms, like social distancing, which is like not people that you don't like, even your friends or family members, like don't have social gatherings right now because, like I said, like I go to work and then say I have a friend who goes to work. We don't know who we're exposed to in our own environment. So you're just making that pool bigger by associating with other people. But that doesn't mean like, when you go to the grocery store, you're not, it'd be different if you're like standing beside that person, like, because a lot of stores now they've made like I think 1 or 2 meter gaps where when you're standing in line too, they're making sure there's a gap there. A lot of grocery stores have aisles now where you can only be going one direction. So people aren't going against each other. Um,
Mhm.
and, they're limiting how many people they allow in the store, but I think it's more than just physical distancing. It's also social distancing that we really need to focus on because a lot of people are not compliant to that. There's still a lot
Yeah.
of people that are having family get-togethers and gatherings, and they don't understand that. Like, they don't know, like, you could have four different like people come from, four different homes, and they could live with other people, and you don't know who that other person's been exposed to, and they could be a carrier, they could be asymptomatic, but still be a carrier, right? So that's why they're saying for people to keep a social distance, so not to socialize with people that you don't have to socialize with, or that you don't live with. And physical distancing, yes, like if, let's just say hypothetically, you and your neighbor want to go for a walk or something in your neighborhood, just keep a little bit of a distance, and don't be walking right beside each other, and once again, because sometimes when we talk, some people, you know they'll they'll sprinkle a little or whatever, so you just don't want to put yourself at risk, right? So
Mm.
um yeah.
No, that's great. Yeah, that was going to be one of my questions for you as well. Is like, um, when somebody else, like, let's say I don't have the symptoms of COVID-19, but could I still be carrying it?
You could be a carrier, yeah, for sure.
So if I've been
animals
exposed to
animals
it
could
some
be
way,
carriers.
even though nothing happened to me or no symptoms are appearing, I could still be carrying it.
Yeah, you could be a carrier for sure.
So right now, like with all these events, like even today, I think Dr. Bonnie Henry announced as well and stuff. Like even though there may be some things that will open up eventually, but basically, I just read an article like a few minutes ago about there will be no PNE this year. There will be no spring festivals or summer festivals
Yeah.
and all those gatherings. So definitely an interesting time. We've never seen something like this in our lifetime. No. So I think just to shed some light on why would they put a stop to these events? Like that's going to affect the East Indian just weddings. I don't think like if we can't have a get together like over 50 people, I don't think there'll be very many weddings this year.
No. So I think the main thing is, like I said, there's not enough research. I
Hmm.
mean, the main thing they know is this virus is very contagious, and it's very easily like, you can get it very easily, like from person to person. So I think the reason why they're wanting to do that is so we don't end up like, I mean, we can't really compare ourselves to places like New York, Italy, and Spain and London because we're not as congested as those places. But at the same time, if we start allowing people to go to congested areas, and right now we don't have a vaccine, there's no verified drugs or medications that,
Mm-hmm.
like this, they what they don't want is that they really let the restrictions loose, and you end up with a huge amount of our population being infected in the hospital all at once. Because it's not, it's really easy to tell, like, they think that it's just seniors, but like it's not, it's everybody, right? And I totally understand. So like it would be nice, like if they remove some of the restrictions and people can start seeing families again, but they're still not going out in public to big events and stuff. I think the importance is so that, we don't have a widespread of population that's getting infected all at once. And until at least they know more, or they feel like it's gone, and most importantly, I think they're going to need a vaccine before that can even happen. So, um, yeah, so I think it makes sense. It's unfortunate. I know it's going to be really difficult. Like you said, it's something that we've never seen in our lifetime. But I think it's just to protect ourselves so that we don't end up, you know, our hospital, our healthcare system, our hospitals and healthcare system don't get overburdened, and they are expecting another wave, in the fall.
Yeah, that was
So,
another thing. Like I think right now, like I've been observing quite a bit, like what's happening in Asian countries or out where it's a lot more hotter than it is here. Because I know this has gone to India and like in China right now. Like what exactly is going to happen with the heat? Because right now they're starting their summer. It's really hot
I
there.
don't know. I have heard that, they say heat kills it or helps kill it,
Hmm.
but once again, there's no evidence-based research that's really been put out there to like verify that. It's just from things that you hear, right?
Hmm.
And India is a hot country, and they've still got quite a few COVID cases.
Uh-huh.
Other places in the world, like Iran, I think they're a warmer country than Canada.
Hmm.
Um, and California, they have so many cases, and the weather there is much warmer than here. So I think time will tell. Maybe it'll help a little bit, but I don't think it's going to completely. I think, like, it's just like when we had H1N1, even though it wasn't as contagious, it took a little while for it to like completely kind of go away.
Hmm.
So I think the first thing is we're going to need a vaccine, and they're doing more research. They're trying to figure out if there's drugs that will help. And I think once that's done, and they can start getting people vaccinated and kind of um, have some control over this, I think that's when we can slowly start seeing things. But I feel like some of these things that have been implemented might just become a new norm. You
Hmm.
know, um,
Exactly. And the other question I had for you was for testing. Now, who should be getting tested? Like, I've heard different things from different provinces. So here in BC, what should we be doing for testing? Like, if I start getting symptoms today, which I'm not, but let's just say something happens, like, and you're feeling some symptoms, what would you say would be a good thing to do? Like, should we
um,
go for testing, not go for testing, self-isolate, obviously.
I mean, I know the BC government has said that, if you are feeling symptoms, but you're somebody, like, it's not severe, like, you have a cough or you have a fever, just self isolate, take Tylenol, what you would do if you're normally sick. But if it starts getting worse, if you can't breathe or you feel like you're getting worse, then they suggest either calling 811 or going to the hospital or calling your doctor to get
Mhm.
some, advice or input to see what your doctor says. But I mean, personally, if it, like, once again, like, it just depends from person to person. But if you're not feeling well, and like, you feel like it might get worse, I would definitely recommend going to the hospital. But if it's just, like, sometimes, and the thing is, like, we might have symptoms and it might not even be COVID, right? I know there have been people that have felt sick, they've gotten tested and they've came back negative. So, because um, it's not the only, you know, um, strain out there, or people with weather change and stuff, allergy season, people are going to feel unwell or not
Yeah,
feel
no, it does happen. So that being said, like, what do you think will actually m- make an impact right now for a person that to stay home, to stay healthy, keep your social distancing? We're hearing these things, so just kind of just following the things that the government is telling us to do, to continue to follow them, because
Yeah,
even though we're seeing the curve come down, what are your
I think
thoughts?
I think basically, like, especially those who are working from home, or those who are not working right now, because there's no work for them. Definitely, they have like that time to actually follow rules properly. So keep the social distance, keep yourself busy at home. This is time to like invest in yourself, and explore your other hobbies, or do things that you normally don't have time to do, because I know that this is mentally also taking a toll on a lot of people. So
Mm.
it's important to, like, go for a walk and keep yourself, or if there's workouts you can do on your home TV, or
Well,
anything, you have a home treadmill or gym.
that's good. But I was talking to a friend yesterday, and she was like freaking out. She's like, I can't go for a walk. Like literally, her family thinks she's gonna die if she goes for a walk outside.
So
So,
like there's like, if you most people have access to the internet, you can go on YouTube. There's workout videos, but there's also meditations. So if people are feeling anxious, they're feeling depressed because of the lack of socialization, especially those who are living on their own. Try to do that. Try to like do some meditations. There's lots on YouTube. You can like just search it in any kind too. And then there's workout videos. There's so many kind of different things. Even other educational stuff. It's free content that you can get on the internet. Um, you know, because I haven't been using my time off um watching Netflix or anything. Like I said, I have been working, so when I have my days off, I try to, like, make the most of them by getting housework done. I will like, reading. I try to go for walks in my neighborhood. Exercise at home. I like cooking and baking, so I try to do that. Call your friends or family, video call. There are so many ways to keep yourself busy, and if you want to watch TV, for sure watch TV. But I think that like, it'll pass. This time will go by before we know it. But I think
mhm.
it's important to follow rules right now so we can flatten that curve. Because if we don't follow rules, we're just gonna this social distancing thing might just spread out longer. So my advice is, yeah, like, follow the rules. Those who are at home, like, have one day where you go out and do all your stuff, and then do your cleaning, so you're not paranoid about like, clean your home properly, and then you're fine for the days that you're not going out. And the like, wearing a mask, like I said, if if it makes you feel better, it's not a bad thing. It's not wrong to wear a mask. Like I said, it's not just to protect yourself, you also protect others from you. So, and if you're not having any symptoms, and you're able to keep your space when you're around people, then you don't have to either. So yeah, just follow the rules, what you're being told by Dr. Bonnie Henry, or what you hear on the news, because I think they're trying to be as forward as possible. And I think so far BC has been really doing really well in terms of, like, I think people are really trying to follow the rules. And you know, we're not seeing a major spike or anything in our statistics. And hopefully, if everybody continues to follow with this social distancing and quarantining, eventually some of these restrictions will be removed. And, once we have a vaccine, and um, there's more research out there, more information, we'll be able to slowly get things back to normal.
Hmm. So the one last thing I want to end it with, and thank you for all the information you gave us today. But one thing I want to hear about is on the other side, like, from the nursing side, because I will tell you the situation. I know somebody that went to a hospital recently, and the nurses there were not using masks and for their daily work, and something may have happened there, but let's not talk about that at the moment. But what's happened is that when I was talking to another family doctor of mine, and I was just, kind of having a general conversation, and they said that there's actually been a shortage of masks and supplies being given to nurses. So, can you give us a little bit of like what's happening on the other side, right? Like, so people can actually understand, like, what are you guys going through every day?
So I personally, I don't wear a mask during my whole shift because I don't do direct patient care. My position is a little bit more in like kind of more on the administrative side. But when I do have to go talk to somebody, like a person that's coming into the hospital, like a
Well, you
patient.
used to be an ER nurse, so you for so long. So, I mean, if you worked in ER and you have so many friends and everyone there, so what are they
I
going
still
through?
do. I still do work. Actually, I work for a support group for the ER. It's just not direct care anymore. But yeah. So basically, the ER nurses I know with Fraser Health, I can't speak for any other health authority, but for Fraser Health, from what I know and from my site, they're very vigilantly wearing masks. And yes, like they have like protective eyewear that they use for their whole shift. Like they have masks, and if they need to change them, they will change them, but they try to make the most use from each mask because yes, there is a shortage of supplies. From what I was told, Canada, when China was going through this, provided a lot of supplies to China, so we're waiting to get our quota back. And I think all the health authorities are trying to order supplies, and they're trying to stock up as much as they can. Um, and we don't know, like I said, you just don't know. Like we didn't know this like 3 months ago or 2 months ago. We didn't know this was going to happen. And so I think just to be prepared. They're trying not to overutilize equipment, but at the same time, I know within Fraser Health, from what I've seen, the nurses are actually very vigilant. They're doing an excellent job. And even me, like if I have to go communicate with a patient, even if it's just talking, having a conversation, I wear a mask. If I have to wear eyewear, I will. And I keep a distance. And so but like throughout the whole country, I don't know, and even throughout the province, I don't know what each health authority is going through, like how much supplies they have. And but I've heard like in New York, nurses were wearing garbage bags, the plastic bags because they ran out of gowns. I mean, we don't have that problem here in Canada, and we don't want to get to that point. So I think that's why like um, they're telling people that if you're not to like if you're feeling a little sick but it's nothing severe, self isolate yourself because for some people it's just going to go away, you know.
Mhm.
And for some people, if you start getting more sick, you might have to go to the hospital. And we just don't like it's not just to save equipment or make sure we're not overutilizing equipment or swabs. I just think that it's just to keep this whole thing in control so we don't have a huge influx of people coming into the hospital. And because right now, and the nurses are also at risk so far. I mean, like I haven't heard anything too bad here. I've heard in other countries and other provinces where like nurses have been infected by other patients, and it might be because they didn't have proper equipment, so they weren't able to protect themselves. So here, like we want to make sure that our hospitals aren't overflowing with patients. And that's why they're telling people, if you don't really need to come to the ER or to the hospital, don't. It's to protect them and to make sure that um, our nursing staff or medical staff, like not just nurses and doctors, there's RTs and there's social workers and physiotherapists, occupational therapists. There's like so many people that work in the hospital, lab technicians that, you want to make sure that we have those people and they're not getting sick. So I think, yeah, so far in BC, I think we're doing okay. But yeah, some people might get like, through patient contacts, they're going to be at risk. So um, I think it just varies. But I think our health authority is doing good so far. And I think BC in general is doing good so far.
Yeah. So are you able to see this flag up on the air?
I am, yeah.
Okay, so this one is our City of Victoria's mayor, Lisa Helps, and she, everyone in Victoria has been kind of putting these in their windows, hearts in their windows for the healthcare professionals. So first of all, I want to thank you and all the other healthcare professionals that do put themselves on the front line for us. And it's not an easy profession at all. And you have loved ones at home and some with, medical issues as well, and then coming home to them and putting yourselves at the front for the community, and it's not an easy profession, but at the same time you've got to have a big heart to do something like that. So thank you, Monica. And I know you personally, so I know that what kind of person you are, but I know this is definitely something that Canadians and myself, I feel so grateful for this. And I mean, at 7 p.m., my kids are out there banging the pots and pans and support. But whatever we can do as a community is not enough for for workers like you that put themselves and their lives in front to just look after others. So thank you so much for your time today. And I think you were
For
great in
having me
on Talk with Des.
on top with you guys. Yeah.
Yeah. And you know what, I want to just thank everyone that watches, because I've been connecting with a lot of my friends, and they've been watching this and they really like it there. And I get that encouragement every day to come back and invite other guests to come on. And it's gotten me through this time too, and be able to shed some light, like the kind of information that it can help others, right? And how they can protect their loved ones and their family, and really be able to know what's right and what's wrong, because everyone's even hesitating. Like, I know a lot of people are hesitating to go out for a walk right now or things like that. And really, what is too far, and what is, and I think you've been a lot of help. And again, it's everyone's personal circumstances. So I want to thank you for that and wish you the best. Stay healthy.
You
And
too.
yeah,
I
okay,
hope
take
all your
care.
viewers stay healthy. Thanks.
Yeah, yeah. Thank you. And wait, Monica will be soon, hopefully bringing us some yummy recipes as well as some other information. So I can't wait. You're a great cook as well. So keep going at it. And like one of the best things you said today, and which I want to remind everyone watching, is follow your passion. Like, do things that you haven't had time to do. Like, that's what I've been doing too. Like, I have recently just fell in love with cooking again. I love
Yeah.
cooking. I'm a good cook, and every time I cook, my whole family appreciates it. And I am an amazing cook, and I'm so proud of it. And I love the food I cook. And now it's just finally I've had the time to cook again like that. Because normally I'm so busy with work, like I'll do things, I'll cook, but it's not to that full extent where I made pani puri one day. Can you believe that? So I know you're an amazing cook, and you've inspired me with some of your recipes lately too, like your cookies and the cheese, a grilled cheese sandwich, just some simple things, but Monica puts a little bit of spice into them and makes it something different. So thank you so much
You're
for being
welcome.
here. Take care, stay
You
healthy,
too.
and hopefully we'll have you back on when things get a little bit, loosen up a bit, and we want to know more tips from you.
Sounds great. Thank you for having
Okay,
me.
you're welcome. Please do share a recipe for my viewers though at some
I
point.
will.
Okay,
All right.
take care.
Thanks.
Take care.
Bye.
Bye.